medication has a really cool release mechanism, and it's pretty unique when you compare it to the other types of stimulants out there. And this is referred to as the osmotic release oral system, or OROS for short. Welcome back, Straight Talkers. Today I'm going to talk about the medication Concerta so that you can be better informed when deciding whether or not to start this medication. But first, please make sure to hit that subscribe button so that you can be the first to know when new content comes out. So Concerta was first approved for medical use in the United States in 2000. It's important to recognize that each medication typically has a generic name and a brand name, and doctors will often use these names interchangeably. So Methylphenidate extended release is the generic name, and Concerta is the brand name. The generic medication has the same chemical formula, but it may or may not be exactly the same strength as the brand name medication. So how does this medication work? Concerta is a stimulant medication, and it works by increasing the activity of the neurotransmitters dopamine and norepinephrine in certain parts of the brain. And this medication has a really cool release mechanism, and it's pretty unique when you compare it to the other types of stimulants out there. And this is referred to as the osmotic release oral system, or OROS for short. So if you look at the components of the tablet, what you'll see is that there's an outer layer that consists of an immediate release methylphenidate overcoat, and this will release some of the medication within the first hour it's taken. Then there's a rate-controlled membrane that has laser-drilled holes in it, and this covers the 3 inner compartments. And the 3 inner compartments consist of 2 drug compartments and 1 push compartment. When the tablet absorbs water from the body as it's being digested, the push compartment will expand and increase the pressure within the tablet. And this increase in pressure will then lead to the rest of the medication being pushed out of the laser drilled openings in the tablet at a controlled rate into the gastrointestinal tract. It is estimated that 22% of the medication is immediate release, while 78% is delayed release. And the average amount of time the medication lasts in the system is around 10 to 12 hours. In adults, Concerta is FDA approved for the treatment of ADHD and narcolepsy. And it's also approved for the treatment of ADHD in children 6 and older. And it's used off-label at times for the management of obesity and treatment-resistant depression. Concerta comes in a tablet formulation, and it's important that you don't crush or chew the tablets because doing so will release too much medicine all at once. So dosing is generally between 18 to 72 milligrams daily, and it's often based on one's weight if being prescribed in children. If I'm using the medication in kids, my approach is to always start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. After your child takes the medication and it's digested, don't be surprised if you see little empty Concerta medication shells in their poop. This is harmless and to be expected. Now let's talk about potential side effects. Right? It's important to realize that many side effects are often dose dependent, meaning that the likelihood of getting them increases as the dose increases. Some are also time dependent, meaning that they begin immediately upon starting the medication or when making changes to the dose of the medication. But what we typically see is that they go with time as the body gets adjusted to it. The common but usually more mild side effects of Concerta include things such as dry mouth, nausea, irritability, decreased appetite or weight loss, headaches, dizziness, insomnia, anxiety, or excessive sweating. More serious but less common side effects include cardiovascular events, increased blood pressure, psychotic or manic symptoms, seizures, priapism, peripheral vasculopathy, visual disturbances, and growth suppression. If you or your child are experiencing any of these side effects, or any others that weren't discussed, please talk to your physician so that they can work with you on determining the appropriate next step of action. It's also important to realize that taking multiple medications at the same time might cause one medication not to work as well, or it could potentially lead to an increased likelihood of side effects. So you should always talk to your doctor or pharmacist before starting a new medication, and make sure your doctor has a list and is up to date on all the medications that you're taking. This includes those being prescribed to you in addition to those that might be bought over the counter or on the internet. The amount of time someone will need to be on this medication varies from person to person. Often in kids, the patient, their parents, the doctor, and the school will work together to determine what is right for each patient. When deciding to come off of Concerta, please do not stop taking the medication without talking to your physician first, because they can help work with you to come up with a plan on how to appropriately stop it. Generally though, there's very few, if any, withdrawal effects if the medication is stopped suddenly, and many families actually choose to do drug holidays on the weekends, holidays, or summer breaks, And this is helpful with reassessing therapeutic utility or even allowing kids to catch up on any growth suppression. The main thing to recognize, though, is that once we stop a medication, ADHD symptoms will come back as soon as the medication wears off and is out of the system. Now head on over to the next video to find out more ways that you can help your child live their best life.